Let's go.
Dr. Rosie Milligan, one of the most sought-after speakers on the circuit today. Her live internet talk show, Express Yourself, is the most provocative, thought-provoking, and talked-about radio show on the internet. There's no holds barred, and Dr. Milligan puts the B in bold. She brings it every Tuesday live at 10 a.m. Pacific and 1 p.m. Eastern Standard Time. Dr. Rosie has been proclaimed the most provocative female writer of the century. Her books include Satisfying the Black Man and Black Woman Sexually Made Simple, Why Black Men Choose White Women, and the book Nigga Please. These books have raised eyebrows across the country. She has authored 21 books and published 350 titles for authors nationwide. Check Dr. Rosie out at drrosie.com for her books, articles, and archives of her internet talk show. Sit at the feet of wisdom. Dr. Milligan is indeed a timekeeper and scorekeeper. She is the clock, calendar, and almanac for Black America. You need to hear her.
Good morning in sunny California. Yes, we're coming from sunny California. You'll listen to the Express Yourself Hour, and I am your host, Dr. Rosie Milligan, coming to you live with nothing but straight talk, because that's how we do it around here, folks, nothing but straight talk. We have a great show for you today.
Recording in progress.
I am very excited about, and it's one that I know millions of people are in the dark about this particular topic. They're going along thinking that everything is well. So we're going to expose some of the things you've been thinking about that you need to rethink. Now, today we're going to talk about the facts about Medicare and long-term care, what most families learn too late. Now, ask the question, what happened after 100 days of Medicare payment runs out? Your Medicare is not a blank check for long-term care. So let this be a wake-up call today. It's time to talk about aging. Well, you can see why I'm talking about it, because, I'm aging and I'm finding out some things. And I think you need to know. So we're going to talk about the hidden Medicare crisis nobody wants to talk about. So it's important to learn what you need to know versus finding out far too later. My guest today is none other than Denise Ridley, medical background as an obstetrician, gynecologist, a financial guru, financial advisor, and life insurance agent since 2006, certified financial planner in 2013, and a Medicare enrollment agent. Folks, you don't get any better than that. You know me. I always bring you the best. That's what I do. Good morning, Ms. Ridley.
Good morning.
How are you today?
Fine, thank you.
Great.
Well, thank you for inviting me.
Yeah, it's good to have someone who really know what they're talking about. I'm telling you. It's just something about being in the financial field and this day and time, and also coupling that with knowing something about the medical field itself. That's what makes me one of the greatest financial planner with trust, wills, and power of attorney, healthcare director, because I have a background in medicine. That and business, and that really adds to it, really makes a difference. I'm not bragging, I'm just letting you know I'm tough, That's all I'm saying. But, I've done some surveys, and most people I talk to, they really do think that Medicare is a blank check for them for life if they get sick or if they're in a long-term care facility. So what is it urgently that you feel that we need to know? And I don't think it's just for the senior. I think it's important for the children, for everybody to understand, because what you know, then they help you to help prepare your parents for their aging, because they don't understand it. So that's why I want everyone, the young people, and you need to know, because you know what the future holds for you. So I think this is a conversation for everybody. What you think?
Yes, I would agree because the more you know, the better you're able to plan ahead. And I know that you chose this topic based on your personal experience with clients who have gone through, learning after the fact.
Yes.
And Medicare is such a complicated, topic that you may think you know a lot, but when the time comes, you may find out, oh, I wish I had known this, that, or the other. Okay, so I would like to start off by discussing Medicare and give some background on that.
Okay.
As many of you may know, Medicare is health insurance that comes into play at age 65 for the majority of people. Disabled people or people with ALS or end-stage renal disease can get it at younger age, before age 65. But we'll just focus on the age 65 because that's the majority of people. Okay. Now, Medicare is not necessarily automatic for everyone. If they are already receiving Social Security, then they automatically start getting Medicare card and it's mailed to them. But other people, those who are still working, those people, they do need to apply for Medicare. And once they are accepted, then there is a monthly premium for the majority of people. Very low income individuals may be an exception and may have their Medicare monthly premium paid. And that's a little over, $200 for the Part B, the medical portion. So Medicare consists of two main portions: the original Medicare that someone would get automatically if they have paid into Social Security over and the FICA tax that's taken out, taxes taken out of your paycheck, or you pay if you're self-employed into the system to be eligible for Medicare. So if someone has worked 40 credits is what they call, which is approximately 10 years, then they're eligible for the full Medicare. Okay. Once they have that in place, they have options. Okay. Basic Medicare or original Medicare means that you have Part A, which covers hospitalization, and Part B covers doctor's visits, lab, and x-rays, and many other coverages as well, but basically outpatient. So you have the in-hospital coverage for Part A, and you have the Part B for outpatient coverage. Separately, there is Part D, which is coverage for prescription drugs. Okay, so if someone has original Medicare, Part A and Part B, then 20% of their incurred expenses are not paid by Medicare. Medicare covers 80%. So that is an important point that people are not aware of, that if you don't do anything other than sign up for Part B, you still have a responsibility for 20% of your expenses incurred. Okay, so there are other choices, and the majority of people do choose the other choices to cover that 20%. And that is choosing Medicare Advantage, which is also called Part C. And if someone chooses that, they need to include or exclude the prescription drug coverage. So you have the option of adding drug coverage there. The other option for those who are willing to pay more is to pay a private insurance company to cover that 20%. And, the cost for that varies depending on the insurance company. The Part B premium I mentioned earlier, the minimum is $200, but if someone has high income, they're required to pay additional. So we'll just deal with the standard.
Okay.
Yeah, at this point.
Can I ask you a question right now?
Yes.
Okay. When you mentioned that the regular Medicare, that's 65 and you're getting Social Security, that Medicare pays 80%. That's if you went to the hospital or you go to the doctor. Is that correct?
Correct. Yes. 80% of your medical expenses is covered by Medicare if you have what's called original Medicare, which is just Part A and Part B. And you pay a separate premium for the prescription drug portion.
Okay, that's why today that many people sign up for HMOs to avoid that 20%.
Yeah, that's called the Medicare Advantage option, and they can include, that's 20% is covered. It's also included with the third option, which is the Medicare Supplement or Medigap, where you pay a private insurance company to cover that 20%.
Okay, because I at one time had a PPO, and I remember when they talked about the fact that you would pay 20%. And then it occurred to me, at first I thought 20%, that's not bad. I want to be able to go to the doctor of my choice, whoever I want to. But then I took a second look at the true cost of medical care. And I thought, now, if I were in the hospital, I could run up a bill for 60 or 70,000 in no time. So then that 20% is a little bit more disgusting. And I start thinking, if you don't own anything, that 20%, it may not be too bad for you to decide you want your choices. But if you own something, you own property, that puts you in a different light. I'm just sharing for me. That put me in a different light, because if you have something that they can come after you for, if you're not able to pay this large bill, if you end up in the hospital in intensive care for 2 weeks, God forbid, that's your house right there. So that's when I made a choice to do the Advantage. It's just certain things you really have to look at the total picture. So, okay.
Yeah, well, I can see your point, and individuals do have the options, and majority of people do choose to get coverage for that additional 20%, because the $1,000, it's 200 right there, $100,000. That's $20,000 that you have to dip into your savings, use your pension, whatever assets you have. Yeah. The fact is that lower income people are potentially eligible to have those costs covered. So it may not be an issue for low income people, but you don't know until you're there. Yeah.
Can I ask
Okay.
a question?
Yes.
My name is Joy. I retired at 65, and I got the HMO, Medicare A and B, and I got United Healthcare Plan. Is that the same as the other coverage, the Advantage? Is that Medicare Advantage?
I heard you say you had A and B, and what was the next part?
United Healthcare Plan. And she signed me up. My lady, she had HMO plan for the A and B, I guess.
Okay. A and B by itself is not HMO. It allows you to go to any doctor and you're not part of a network.
Okay.
But when you get Medicare Advantage plans,
Mm.
you are in PPO or HMO,
Oh,
and
okay.
there are other hybrids as well. But the
Okay.
most common is HMO, for example, Kaiser,
Uh-huh.
and there are various networks of physicians that you need to go to.
Okay.
And if you don't go to those physicians in that network, then
Mm-hmm.
you're responsible to pay out of pocket.
Okay. Yeah, I remember saying something like they said something like that. Yeah. So I have uh health what's it? United Health.
United Health.
Yeah, I have United Health Care plan, whatever.
Yes.
Yeah.
So that they have a network of physicians in
Okay.
the different plans.
Oh, okay. I see now. I okay. My
Okay, so does that answer your question?
yes, yeah, I was just getting a little confused. So that the A and B is by itself, and then your Advantage plan is whatever you signed up for.
Yes,
Okay.
usually you're signing up for United Healthcare, Aetna, it could
Uh-huh.
be Kaiser,
Okay.
you know, it could be, several of the other. Humana, for example, is another.
Okay. Then
hmm
go ahead.
Anthem.
Go ahead.
You
Oh, you're not.
finished,
I
Joy?
just said Anthem was another
Oh,
one.
Anthem. Okay. So I know
hmm
people change. They change with different ones. People kind of change up, but I still stay with the same one. I just don't want to be.
Okay. Yeah. Yeah. You can make, just automatically renew, or you can change during the enrollment period, annual enrollment period. October 15th through December 7th are the dates.
Okay. Thank you so much.
But, if special circumstances
Mm-hmm.
arise throughout the year, you may be eligible to change. But basic, generally, you're locked in until that next annual enrollment period.
Okay. And I noticed too the dental they don't cover too much well on dental.
Joy, did she
Original
answer your question?
Medicare doesn't.
Huh?
Original Medicare doesn't, but where you just have the basic A and B. But if you have a HMO through the Medicare Advantage, or the other name for it is Part C,
Hmm.
they offer various amounts for dental coverage, vision coverage. So they offer more than the original Medicare alone.
Thank you.
All right. Okay, so any other questions now? Do you want to do questions now, Dr.
I'm
Rosie?
sorry,
No,
Dr. Rosie.
no, go forward because there's so much to cover. But
I'm
just
sorry, Dr.
Mm.
Rosie. I'm sorry.
About
when
what?
Oh, for interrupting the flow. I'm sorry.
oh no, it's okay. No, you can. That's why we're here to get answers, baby. You didn't interrupt the flow.
Oh, okay. Thank you.
Yes.
Yeah, we wouldn't charge you with the crime here. Okay. All right. So uh, let's talk about long-term care.
Yes.
Long-term care is for individuals who aren't able to take care of themselves. For example, they're not able to feed themselves. They're not able to bathe themselves. There are six activities of daily living that they use to decide if someone is eligible for long-term care. And, as I mentioned, um, being able to walk around, ambulate is the word they tend to use, transfer in and out of bed, being able to go to the toilet, to be continent, bathing themselves, dressing themselves, able to feed themselves. If someone has two out of six of those issues, then they would be considered eligible for long-term care. Long-term care is considered custodial care. It doesn't necessarily need a licensed professional. It can be care given by someone in the family, or hired care in do long-term care. And that also includes activities at an adult daycare center. If someone continues working, the caregiver is working, and they can get a break during the daytime by sending their loved ones to a adult care center. So we call long-term care custodial care, just taking care of those needs that the individual has. So this can be covered by or paid for with funds that someone has in savings, their personal funds, or what's available also is long-term care insurance. So this is not covering hospitalization for acute illnesses, but for example, in a nursing home, that's an option. So you could have care at home, care in a nursing home or skilled nursing facility, or there are variations such as assisted living, which is less intensive. And there are also other names for long-term care. So the main point that Dr. Rosie wanted us to discuss today is the fact that Medicare does not necessarily pay for long-term care or custodial care. No, that's not part of the goal of Medicare. Medicare pays, if, for example, if someone goes into a nursing home and they apply for coverage, if they need additional financial assistance, they'll realize and be informed that Medicare only covers them for 100 days. The first 20 days, they don't have to pay anything, but after that, there's a charge for the stay from day 21 until day 100. And after that, the charges incurred are the responsibility of the beneficiary. And that's something that a lot of people aren't aware of, and why we keep saying Medicare can be complicated. So what can you do when you reach that point? That's where the advanced planning, being prepared, being knowledgeable comes into play. And if someone is in the low income bracket, oftentimes before they even leave the hospital. Oh, by the way, I want to emphasize that Medicare pays for that 100 days after the individual has been hospitalized for 3 days. So usually it's a minimum of 3 days of hospitalization before transfer to the nursing home, and then Medicare, starts covering after that.
So,
Okay.
one other question: after they pay full coverage for the first 20 days, after the first 20 days, you can be there for 100 days with them covering
No,
part. Okay.
for an additional 80 days. So the first 20 days, no payment is required. But
Okay.
then after day 20 to 100, they do pay. And usually it's about $217, and average nursing home costs can be around 400. Could be higher depending on the luxury
Right.
and other amenities. Yeah. Mm-hmm. So
Okay.
is that the question?
Yeah, but you do have something out of pocket for those next 80 days.
21, yeah, after day 21, 20.
Wow.
Okay, so yeah, that is the main point here, that after 100 days, Medicare doesn't necessarily pay. So what are your options after day 100? You can use your savings, income from a pension, for example. You can have long-term care insurance, and that preferably you get it when you're younger and have it in place before you need it. Just like life insurance, you want to get life insurance before you need it, and at a younger age, you have a lower premium, for both of them. Or when you're older, you have more health issues, and the cost may be higher, or the company may not accept you. So you may not even be able to obtain the long-term care insurance.
Let me ask you another
Yeah.
question about that, because some people, they have long-term care insurance. I know with your insurance background, you'll be able to help us with this. When you ask them, when I ask the question, how much coverage do you have? Is it dollar amount, or is it like a year or 2 year? Are these some questions that a client need to be asking the person who, who's writing the long-term care insurance for them? Because some people think once I have it, they think it's like what they think about Medicare. As long as I live, I have that protection.
Yeah, well, has to be highly customized to the individual, and oftentimes, well, because long-term care, the majority of people, it's less than a couple of years that they need long-term care before they pass on. So it's the majority of people don't need it for an extended period of time. That's what the average says. Now, when we go to the nursing home, we see people there, for years, but I'm telling you what the numbers are out there.
Okay.
That's what they state. So they have plans, let's say for coverage for limited period of time, or for, let's say, 2 or 5 years. And if it's for a lifetime, however long that person is in the facility, and they have unlimited, time, lifelong, coverage for the long-term care, then those are going to be more expensive. So it has to be worked out with the individual. And in some cases, the cost may go up, because of inflation, the premium may increase as well. So, it has to be detailed going through with the individual applicant. Yes.
Okay.
Mm-hmm. Yep. So, are there any other questions regarding the long-term care? But that's mhm. Okay. So, the other area I wanted to mention is that in California, there is a possibility that the client can apply for Medi-Cal to cover their long-term care. And if they are accepted, one thing to consider is that when that patient dies, there is a possibility that the state of California can look at their estate to recoup. It's called estate recovery. Recoup some of those costs. And, that is something that, long-term care helps, minimize. So, the other thing with regard to Medi-Cal estate recovery is that if someone has a living trust, they're not exposed to that, but they do go after assets that are subject to probate. So Dr. Rosie can speak more on that, but the fact of the matter, this is another reason to emphasize the need for establish a living trust in advance, so that whatever you wanted to leave for your family will go to them rather than to the state to cover healthcare costs. Okay? Yeah. So I would like to get some feedback. Anybody have any questions about that?
Let's see. Someone
I
said,
have a question.
Go
Uh,
ahead.
good morning, Dr. Miller.
Good
Good
morning.
morning, Sister D. When you said that the state will, take a look at whatever it is this like the insurance, the whatever it is that you have? Is it everything that they look at?
Oh, no, they don't look at everything. And actually, this is an area that is in flux, as a matter of fact. You're allowed to keep assets of, up to $130,000. And if your spouse is living in the home, they don't, look, pursue it. If your caregiver is a spouse, a child, adult child, or sibling. And as of January 2006, the assets that they look at are the home, bank. This is a change from before. The
Yes.
home, bank accounts, second vehicle. Okay. And they look at whether you transferred, whatever you owned. Let's say you transferred your home to a relative for less than the market value. You transferred it at a lower sale price, for example.
Mm-hmm.
Then they look at that, and that can delay your getting help through the state when someone applies for Medi-Cal.
Thank you.
But it's not a monetary penalty. It's a delay. You can't get in on the Medi-Cal coverage until they calculate, the amount of money. Their guidelines for that. And a lot of detail.
So you may have to sell that extra automobile. If you have a second property, they're not going to cover you for Medi-Cal.
Mm-hmm.
And they have that 30-month look back. I wonder how much do they really go into that look back?
Mm-hmm. Well, based on what I've read so far, this issue doesn't come up very frequently.
Okay.
Yeah. Mm-hmm. Okay. All right.
Oh, well, let me ask you this question. Since the Medicare, that requirement for income for a single person, I think is about $1,800 a month of income. Now, if a person is only making $1,800, they can't even pay rent. So it's really something that the public really need to be aware of. That's why, I had you to come on to do the show, because we're just stabbing in the dark thinking that everything's going to be okay. But even though you may have the house that's exempt, that you can still get to Medicare, you can have the $130,000 in assets, but if your income, which they want to see your bank statement to verify what's going through your account, some verification. But if a single person has only $1,800 a month and they're not eligible for Medi-Cal, then the point it goes back to, where is that money coming from? Now, I have been asked a question. If that person's in a skilled nurse facility and they do not qualify for Medi-Cal and their Medicare has been exhausted, that 100 days, somebody asked me, what happened? Do they put them out of the facility? I don't know. I was asked that question just a few days ago. I'll look into it, but I did have one client that he had to bring his wife home. She was on all types of tubes and IV therapy, and he said he was going to have to get a reverse mortgage to get enough money to pay somebody to help take care of her at home, because she was discharged from the facility. And I don't have the answer to that, but some of you on here, I think is worth looking into, calling, finding out for yourself. That's a full-leaded question. I didn't have the answer to it, but I just want to bring it up because someone did ask me that. What do? Do they send them home? And someone said, well, they can't kick them out of the hospital because they can't pay. Oh, really?
Mm, yeah. Well, you have limited choices, and if somebody needs to be transferred to a facility, they don't have a choice of where they go, and they just have to go wherever, because some people may not have a spouse or somebody else to provide for them. So it's illegal to put people out on the street. That, they just have to work out the finances afterward.
Okay, well, that's good news. Okay, maybe everybody don't need to know that, huh? Maybe
but it,
that's
but
why
it,
maybe that's why that isn't common knowledge.
say that again.
Maybe that's why that isn't common knowledge, because a person may say, well, they can't do nothing but keep them if we don't have the money. It's a mess.
Hmm.
It's a mess. But for those on here, this show is about planning that your family is not put in a bad predicament. Neither are you put in a bad predicament.
Hmm. Okay. All right. Any other questions at this point? No. Yeah, because I feel that we've covered the main topics. If you can think of anything else, Dr. Rosie.
Well, I want to be clear, and for those who are online and those who listen, I want you to be very clear because people are very confused about Medicare. Like I said, many times they think it's a blank check. So I think we're getting this information. It would help you to start doing better planning, start looking at if something happens. If I have to be in the skilled nurse facility, I think it's time. I think it's time for a family talk, or Denise. I really do. I feel that families should come together at least every 6 months and have a sit down over the table conversation to really look at their financial responsibility, to look at the fact if they need to update trusts, if they need to do something about their insurance. And I've said many times, Denise, to children, particular when there's no like life insurance in place. If you have a parent that's just balanced from a financial standpoint, I never understood why the children could not come in and pay for them a life insurance policy because they're actually beneficiary and they're the one that have to, bury the person when they're gone. To me, it's just some people say I don't make sense, but I think that makes sense. But for the children to pay for a policy, you're the beneficiary and you're the one, because usually it's one person when something goes wrong that have the finance to bury the person. And everybody else, I ain't got no money. My kid in college, I just got this. So the burden is always on one person in that family. So to me, it makes sense for children sometimes to step up and have a policy on their parents. You in the field, tell
I
me what
am.
you think.
Yeah, I understand what you're saying, and it does make sense to me. And it's something that I mentioned, in terms of life insurance as well.
Okay. Okay. For those who are online, what's your take on that? Because if you come together, here's what I'm finding. Most kids don't know anything about their parents' business. They don't know if they have uh barrier, prepaid barrier. They don't know if they have insurance, and sometimes the parents would say, "Oh, I have life insurance." They do. They got it 50 years ago. It's $5,000 policy, and that's not going to bury anybody. So I think it's important to come to say, well, mommy, if you get in, position where you can't take care of your basic needs, because your kids could be out of state in another, out of
Mm.
state. If this would happen, what if? It's nothing wrong with talking about the what ifs.
Right.
So, what if you get when you cannot care for yourself, mom? Do you have savings? Do you have insurance? It's just things that people need to talk about.
Mhm.
There are people who has been recommended to, even they got a lot of equity in property. Some of them are looking at now, Denise, doing a reverse mortgage, putting that money, making it work, not throwing away in investment, but at least having something that they can pull on in case they need it. At least they could pay somebody 4 or 5 hours a day to come and help them. Because even if you have a daughter or son taking care of you 24/7 for one person as a caretaker, folks, do you realize what that's like? 24/7, day and night. So I just don't understand why we're not having those conversations. So somebody tell me, why aren't those conversations being carried on in families?
Well, go ahead.
Oh, this is Dr. Betty. I can tell you that when it came to my mother situation and she was the wife of a veteran, they would send letters. And so I had started help taking care of my mother when I first saw the signs, taking care of her paperwork. And the Veteran Administration would send a letter every year saying, do you want to keep this plot? You know, because they bury you on the Veterans Administration property. And then she had been receiving Veterans Administration checks. And so I assigned myself, even though my mother had to put her little John Doe on there, I took on that responsibility because I knew I was responsible. And when she passed away, it just went so smoothly and in order, and I didn't have to be begging, sister this or brother that. Even though they offered, I didn't have to worry about how mother was going to be buried, and what was going on with her. And so I took on that same avenue with 2 of my daughters that I put them on my paperwork so that if anything happened to me, they would know where to go and what steps to take.
But Dr. Betty, let me ask you a question. I think you're saying that your father was a veteran, right?
Yes.
So that means automatically if he's married, then his wife is covered to be buried there also. Is that correct?
That's correct.
So they were writing to find out if that would be her choice. Because sometimes the veteran wife or husband may say, well, I don't want to be buried in the veteran cemetery. I have a crypt or so in Inglewood or whatever. So that's what we're talking about. So they want to know, I guess, so they could release that spot, right?
Yes.
Okay.
That's correct.
Okay. All right. If she chose not to, could another family member or just for the spouse?
Yes. He was deceased, so
Yeah. Okay.
that was already. So another, if she chose not to, then we would have went into another avenue of talking to a mortuary to make sure she would be covered,
Okay.
because she had started having dementia and she couldn't remember, and I kept all the files in the file. I mean, it was so nice because when I did pull the drawer open and looked at her files, she had it in so perfect order that I didn't have to really scratch to figure it out,
And that's good, Dr. Betty. That's why I'm saying family. I'm telling you guys, you need to gather your family together to discuss these things. It's really important. You can't wait till the last minute, because trust me, only one person going to have some money. Everybody else, I ain't got no, call Dr. Betty. She can do it. It's going to always be one in the family.
Yes, so true.
So
Hello, how you
yes.
doing, Dr. Rosie?
I'm
Hello,
wonderful.
Dr. Betty. This is Vanessa Haynes. How you doing?
Hi.
I wanted to speak on. You're absolutely right about getting the family together, and I was really surprised talking to people in my age group that just simply did not even want to talk about insurance or what to do or this. It's almost as if they thought if they talked about it, it was going to happen.
Vanessa,
So they were like really resistant to me.
What's your age group, Vanessa?
Oh, I'm 71.
Okay, go ahead.
So yeah, so you would think at that age you would be a little bit more likely to discuss those kinds of things. because you've been on this earth for a while and seen a whole lot of this, that, and the other.
Yeah, you
And
done
so
had your 3 scores and 10, and you
you
still don't
had
want to
your three
talk.
scores and ten. Yeah, but I could not believe how some people are just downright resistant to even talk about it. It's almost as if the attitude is, well, I'm dead. It doesn't, what difference does it make? Or something like that. And then, but I don't think some of them, it may not be that. I kind of think that you have to just like at family reunions, make that a part of the schedule. You know how you schedule all kind of stuff at the family reunions. That should be one of them.
But
You know,
Nelson,
having a
I think
presentation.
I think you're right. That's what I have suggested to families. It should be more than about meeting and eating, because once you leave, you don't even contact the people that you met at the reunion.
At
So
the
it should
reunion.
be someone there talking about insurance, estate planning, talking about Medicare, talking about these issues. In fact, they should be bringing people in like Denise. You know, they should. I mean, you or the
Mhm.
family reunion should put together a budget to bring expert people in
People in to
to
talk
talk to
about
their
that.
family about foundation, about scholarships, about insurance. So those of you who are on here, you need to make that a part of your discussion. So Denise, what's the reservation with people not? Are you finding that they don't want to talk about it? What age group is more prone to address this?
I thought
Uh,
that the
well,
most.
Or our
generally,
guest, Vanessa
Oh, I'm
Hope.
sorry.
Okay,
Oh, okay. Who are you asking for me? I'm
the
sorry.
guest. I'm asking Denise Ridley, our guest. She does
Oh,
the
oh,
Medicare
oh,
insurance.
okay, okay,
She's the expert in that field.
okay.
hmm okay. Young people, for example, commonly don't want to talk about it because, like they say, it's dealing with the mortality. They figure they're going to live forever and be healthy forever. But once people get into their older age, 50s, 60s, they see people passing around them, and, the complications that their, contemporaries experience, they're more likely. And I think there's also a cultural issue. For African Americans, oftentimes they just don't want to talk about it. And, I've heard over and over, let them work for their own thing. I don't want to leave money,
Yeah,
you
I
know,
got mine. They get theirs, huh?
yeah,
Uh-huh.
which is unfortunate. And, it's different in a lot of other cultures, compared to the African American. But people who have accumulated assets and are doing well financially, tend to be more aware and more educated, so they're more likely to plan, even have life insurance for their children, at a young age. So, I would say that, around 50s, 60s, in the African American community, they're more likely to think of it, and see the importance of it. And family meetings, I let my son know he's in his 30s and he has his life insurance, and I had set up a life insurance for him when he was in his late teens. Yeah. Yeah. So, uh, it's something that needs to be discussed. People think about final expenses, more nowadays, but,
Yeah.
because of all this GoFundMe that they see all over the social media. But it needs to be discussed when people are younger, because you're more likely to be healthy and you're more likely to have a lower premium. Yeah. And I did want to summarize a little bit the main points that I wanted to make, and we've repeated it several times, how important it is to be aware of the limitations of Medicare covering long-term care. And the fact is that long-term care insurance is available, and definitely you want to try to get it when you're healthy and when you're younger. But, the majority of people, they're in their 50s or 60s when they really think about and seek it out. But, that's a consideration. and you have to see if it makes sense for you. Yeah, so, and there are different ways of paying for long-term care. One other point about the long-term care is that it's a use it straight. Long-term care is a use it or lose it. Yeah, so that, like some insurance, other types of insurance, yeah, it's you may never see any money coming back to you, but you're paid into it just in case. So that's similar for long-term care. The other point is have a living trust, especially if we consider how the laws in California, whereby you are not at risk for paying back an estate if cost for your long-term care is paid some way or the other using state funds through a Medi-Cal, coverage program. So those are. Oh, the other thing about long-term care payment is that sometimes you can get life insurance with a rider that covers long-term care. And if you don't use it for long-term care, then that money stays in the policy and goes to your beneficiaries. So it could be through life insurance, it could be through an annuity with a long-term care rider as well. And it's best to do a comparison, see which works for your situation.
Well, Denise, could you tell us what service you can provide for my listeners?
Okay, I provide basic Medicare enrollment, for example, into the Part C, Medicare Advantage, and also Medicare Supplement. Another name for that is Medigap, where you have a choice to go to any physician. You're not in a network. Any physician or any hospital throughout the country that accepts Medicare. I also do life insurance, and I also do annuities as well. I don't do the, financial planning with investments in mutual funds, 401ks, 403bs. I did that previously, but not currently. So I'm more on the insurance end at this particular time. And I referred to Dr. Rosie for a living trust.
Yeah, and I appreciate that. You want to tell them how they can reach you? We may have some, if they don't, they may know someone. And it's really nice to have a reputable person. She would not be on my show if she wasn't that. You guys know me that well. So I do want to provide information how they can reach you, because they may need some of those services, or they know someone that needs the service and they want to put them in the hand of the right person. How can they reach you?
Yes. If someone's turning 65 or they need to make some changes with their Medicare, they can get in touch with me and for, life or annuities. And it will be 310-721-7397. And my email is Davis, Davis, Denise, Denise, 69 @gmail.com.
Can you repeat that phone number?
310-721-7397.
Okay. It's life, annuities. You mentioned one other.
Oh, Medicare enrollment.
Okay. Are there any other questions? Betty, you have your hand up. Go ahead. Dr. Betty.
Yes. I have a granddaughter that was born with a heart condition when she was first born. She is 16 years old now, and she's doing good. But I found out that her mom dropped her life insurance. And I've been trying to get life insurance for her and my other daughter, too. And we've been denied like 4 or 5 times. So how can we get life insurance for her. I mean, her mom don't even know where the policy is. She don't know what happened to it. She just know to my, I'm like, we started it when she was born. The doctors told us to start it.
Mm-hmm. Yeah. Well, it's up to the insurance company, when they do underwriting, and if they see that someone has a potential lethal early in life, lethal diagnosis,
Uh-huh.
they're not likely to accept that person.
Right.
So if there's any possibility of locating that earlier policy, that's your best bet. Yeah.
Okay. Well,
And
I did.
Dr. Betty,
Uh-huh.
And then there, rarely, there's what's called a guaranteed life policy that's very expensive, where some companies, not very commonly will, accept someone like that, but the premiums would be way up there because it's like an older person would pay a high premium because they're like more likely to pass away.
Right.
Yeah.
and
Okay.
my question would be also, Dr. Betty, when you think about life insurance, I think we have to go and look at the goal and the purpose. Usually,
Okay.
when people got life insurance, in case the person passed away, for most people, they want to make sure they have money to either bury them or they have money to take care of those that they are taking care of who are leaving behind. I think people have to put that part in perspective. And if that is the case, then with not being able to get the insurance, just think of what you would be paying and just make sure do an account that would bear interest,
Uh-huh.
that it would grow the money in case something happened to that person, because no one would be dependent on her to take care of them. So we're looking at an isolated case with, you know what I'm saying?
Yes.
So those are some things I would consider.
Okay.
Put in the money that it can grow someplace, and if something happened to her, at least you're not out of pocket to have to
Right.
bury her.
Okay.
Did that help?
Yes, that did help. And
Okay.
I did contact a particular mortuary, and they do have a program. They say that you can just pay into, but it's only, I was concerned, I was looking at it from a family perspective. Like, if I open up this policy, can anyone, you know how it seemed like soon as one person passed away, then you got another one and another one and another one. And so I was looking at that. It could just be a family in policy. So whoever passed away, if we choose to say, well, go ahead and bury that person, and take care of that person. But they said no, they can only have one name on it.
Right.
Okay.
So you could choose another way, like I said, whether it's annuity or whatever special account. And
Okay.
then, like we did for family reunion, we were going to do emergency fund, and whoever needed that money first would be able to use it. But that didn't go into place because Denise, everybody started talking. Well, so and so gonna be the first one to need it. So
Yeah. But now that you mention it, yeah, you could have, a fund that you set aside 5,000, 10,000, 15,000 that you set aside just in case, and then it can be used for whomever.
Okay.
It doesn't have to be because you're really limited based on her diagnosis.
Yeah.
In terms of getting a life insurance policy. So just having a fund set aside, I guess she would be the primary person, but it could be for anyone you choose.
Okay. All right.
But
Thank
they
you.
say the average cost is about 15 to 20,000,
it's unbelievable.
for a
Yes,
funeral.
okay.
Yeah,
Yeah.
or you could set it up for family member who needs it. They can borrow the money and it'll have to go back in the fund. That's one way I'm teaching people, Denise, what they can do. Set up a fund, a burial fund for the family, and whoever need it, but they can't go talking about mama want a blue casket and she always wore this dress. You can't be dictating all that stuff. But if you get the money from the fund, it's a loan. Now, some family members may never pay it back, but they'll just die owing it. I think that'll help a family, too, if they know they can borrow from that fund and pay it back. Does that make sense, Dr. Betty?
Yes, yes, definitely.
So
Thank you.
we're gonna have to get creative with this thing. Brenda Ellis have her hand up.
Okay.
Brenda, go ahead.
Good morning, everyone.
Good morning.
I have a quick question. If there is a person that has a condition that most insurance won't cover, final expense will cover that without any restriction on a person's medical condition. Is that right? Because final expenses just takes care of the burial needs for the individual.
Yes, that is correct. Final expenses don't care about your medical condition. You're paying for the service, like whatever the casts are going to be, whether it's going to be a crib or be in the ground. Yes, that is correct. Dr. Betty, you had your hands up, or you forgot to put it down?
I'm sorry, I was trying to lower it and it kept doing something weird.
Well, you guys, you know what? Believe it or not, it's 11 o'clock, and I just want to thank you all. And you guys really need to tune in every week because we're bringing you information that you're not going to hear on Channel 2, Channel 5, Channel 9, but you're going to get it right here. And not only for you to tune in, you need to make sure that you let your family and friends know about the Express Yourself hours. And I want you all to unmute yourself, and let's give Denise Ridley a round of applause because she's giving us some information. You guys, just unmute. Let her see your face. Let her see your face. Give her a hand.
For this.
So now
I
you can start
appreciate being here.
absolutely preparing for your old age. You know, like we had one client, his daughter was he was 89, and she was trying to get him to help her buy a washing machine because she was washing all his clothes because he was incontinent every day. And he told her, I'm not going to do that, and I'm trying to save for my old age. So you got to get with your family. Just let them know where you are because they may say, Mom, that's all you got. And then they may start saving or trying to help you because guess what? If you're not asking your kids for anything, they think you're doing well. And if you own a house, they think you got it made. If you got a car, but they never thought that you may not have but a very little in the bank, and they never ask you about that insurance or your burial. So if they don't bring it up, say, let me gather around, let me tell y'all. You may think you got this, but Mom ain't. Then they go, what? Give them a surprise, okay? All right, you guys, have a great day as you go on your way again. Denise, thank you so much. I really appreciate you. You guys remember that number? Remember when you're looking for annuities, you're looking for life insurance, you're looking for the Medicare, assistant. Not money now, because some people get mixed. When you say assistant, they think you're talking about money. We ain't talking about no money around here. We're talking about service and benefit. Make sure you call Denise Ridley. You guys have a great day as you go on your way.
Hey,
And
thank
see you
you.
next week. Thank you so much.
Thank you, Miss Ridley.
Thank
All
you.
right.